The evidence-based treatment that our group will be presenting is multifamily group therapy. We're going to start it off by giving a concise overview about the therapy and what the settings are, um, how it works. We're going to start it off by giving a concise overview about the therapy and what the settings are, um, how it works. So, what is multifamily group therapy? Multifamily group therapy is a type of therapy that involves working with a group of families, the patient or patients, and it is typically in a controlled setting. Ideally, you'd want to use this type of therapy with families that are experiencing the same issue. Usually, so what is multifamily group therapy? Multifamily group therapy is a type of therapy that involves working with a group of families, the patient or patients, and it is typically in a controlled setting. Ideally, you'd want to use this type of therapy with families that are experiencing the same issue. Usually, so kind of the history of multifamily group therapy. Uh, the early the early beginnings of it was roughly around 1953. It started off with a group of girls who were experiencing schizophrenia, and their mothers were concerned about their relationship with the child. And so they started having meetings to kind of talk about how that was going. So, kind of the history of multifamily group therapy. Uh, the early the early beginnings of it was roughly around 1953. It started off with a group of girls who were experiencing schizophrenia, and their mothers were concerned about their relationship with the child. And so they started having meetings to kind of talk about how that was going. So, what are a few of the goals of multifamily group therapy, and what is the frequency of the meetings? So, the goals of multifamily group therapy are to improve patient and family communications, but more importantly, support from other families that are experiencing the same issues. For example, you could have a child who has autism, and as we learned in class, it can be a challenging thing, but there is, more of a reassurance once people meet others who are experiencing the same issue. So this kind of helps people cope with that. So what are a few of the goals of multifamily group therapy, and what is the frequency of the meetings? So the goals of multifamily group therapy are to improve patient and family communications, but more importantly, support from other families that are experiencing the same issues. For example, you could have a child who has autism, and as we learned in class, it can be a challenging thing, but there is, more of a reassurance once people meet others who are experiencing the same issue. So this kind of helps people cope with that. So, what is the role of the therapist in multifamily group therapy? And the role of the therapist in this is to help families identify their own strengths, invite families to analyze their own behavior and make decisions on things they want to change. For example, if they want to see change in the actual patient, or it's also important to make goals of how people in the family might need to change some of their behaviors. The role of the therapist is to lead by following. So, so what is the role of the therapist in multifamily group therapy? And the role of the therapist in this is to help families identify their own strengths, invite families to analyze their own behavior and make decisions on things they want to change. For example, if they want to see change in the actual patient, or it's also important to make goals of how people in the family might need to change some of their behaviors. The role of the therapist is to lead by following. So
This is Chelle, and I am here to talk to you about the principles and techniques of multifamily group. So the first principle of multifamily group therapy that I'm going to talk about is universality. Essentially, this means that each family is able to see that they are not alone in their struggles and that they're universal to other families. So they might be struggling with drug use or mental illness or physical disabilities, and they can see that the other families that they're working with are also struggling with the same things, so they're not alone. The second principle of multifamily group therapy that I'll talk about is empowerment. And that means that by helping other families who are going through all of the same struggles that they are, the families in multifamily group therapy are empowered to solve their own problems, and they gain confidence in their own abilities to do so, because it really gives you a lot of confidence when you're helping somebody with the things that you're going through and you realize, hey, I am doing a really good job and I can keep doing this. The fourth and fifth guiding principles of multifamily group therapy that I'm going to talk about here are support or acceptance and hope. So families in multifamily group therapy, what they're really doing is they're building a network of families that have the same issues that they do, as I've talked about before. And between those families, they're creating friendships and alliances in an environment where they receive support and acceptance. And those are people that they can reach out to on the outside when they're struggling and other people really just don't understand what they're going through and aren't really accepting them the way that somebody else who's going through the same thing will. As far as hope goes, by watching other families to make progress in multifamily group therapy, it helps families to build that hope that they also have the ability to make progress in their own troubles. Because it's really easy when you're going through something really tough to say, I'm never going to get through this. This really sucks. But when you see somebody else who's been there and who's still going through it and is still struggling, but they're making progress and things are getting better, it's easier to say, hey, I can do that too. The last two principles of multifamily group therapy that I'm going to talk about here are experimentation and the commitment to change. With experimentation, families understand that the group that they're in is a safe place to do all of these experiments with the new techniques and skills that they're learning through therapy, so that these families can get feedback, even from other families as well as the therapist, before trying to use them in real life. Because we all know that when you're in therapy and you're sort of just in this little bubble by yourself, you and the therapist, it's hard to really know how what you're using and what you're learning is really going to work, how it's going to work out in real life. But with these other families that are observing and have their own experiences and their own thoughts, it's a little bit more realistic when they can say, hey, that's not really going to work. Or maybe this would go over better if you're trying to confront someone, something like that. As far as commitment to change, so by coming to the group, families are publicly committing themselves. I mean, not really publicly, but among these other families, there's all these other families there that are seeing that they're committed. And if they're sort of sliding on that commitment, those other families are there to hold them a little more accountable. And they're, in this way, subtly exposing themselves to some of that peer pressure that encourages change. So it's like when you are on a team and you go in and they're like, hey, I missed you at practice last week, where were you? Or, hey, it looks like you weren't doing that homework that we were supposed to for class, or whatever. And it's just these other people that are there to kind of keep you going and give you just that subtle little push that a therapist really shouldn't do. And that is the commitment to change. So the last thing that I'm going to talk about here is the techniques that are pretty central to multifamily group therapy, or at least unique to it. So the first one is called fish bowling, and it means you can do all of the traditional things that you would do during a family therapy session, but it's in a group environment to receive feedback from other perspectives. So it's like when you're practicing those skills or doing those role plays, the other families are kind of watching you and are able to give you feedback versus just the perspective of the therapist. And it's almost like you're that little goldfish in the bowl over there where everybody's kind of watching you and seeing what you do, not because they're judging you, but because they're interested in what you're doing. The inner versus the outer circle allows the family members who have the same role between families to interact and be observed by the group. So say the two moms from, different families will interact and the rest of the group will sort of watch and see how that goes. So say they're talking about the different ways in which they work through their struggles with their husbands or their kids and how they work on change with those people. The interfamily role play is where members from different families interact together as though they were in the same family. So you'd take a mom from one family and a dad from one family and two different siblings from two different families, and you'd smush them all together and they would try and interact as a family unit just to see how that normal interaction might work and how they might better do that. And the reflecting team is also something that's fairly unique, but not necessarily to multifamily group therapy. So the reflecting team is where the therapists, because there's usually two therapists working with these families at the same time, it allows them to talk and make observations among themselves about the group as a whole as well as the families within it, because what one therapist is noticing, the other one might not.
Multifamily group therapy, or as abbreviated MFGT, has been used worldwide, involving a variety of populations and in settings where family involvement in the treatment process is pursued. MFGT groups tend to involve a collection of families and others that are facing similar issues. When MFGT is allows the community to enter into therapy with other families and allows an individual to experience his or her own family dynamics in other families without being overwhelmed by his or her own family context. Locations where this takes place involves general community hospitals, state psychiatric hospitals, private psychiatric hospitals, community mental health centers, prisons, schools, drug treatment programs, and guidance centers. From each article I reviewed, it shared the same scope of different diagnoses meant for multifamily group therapy, and ideally it is suited to work with families facing similar problems. I found it interesting how, according to Strelnick's article, the individual who was the first to publish the multifamily group therapy back in 1964 had used multi-group family therapy in a hospital setting with schizophrenic patients. He then reported how multifamily group therapy was time efficient, cost effective, and this is when he noticed he had produced a change faster than therapy with individual families. Since then, it has grown. It is not only meant to work with individuals experiencing schizophrenia, but other diagnoses. Multifamily group therapy is used to treat multi-problem families that involves a diagnosis and or standardized issue. Diagnoses that are included involved mood disorders, anxiety disorders, eating disorders, substance abuse and chemical dependency, major depression, conduct disorders, psychosis, ADHD, autism, and as previously mentioned, schizophrenia. Multifamily group therapy is also used during dually diagnosis, or in other words, coexistence of a psychiatric and or a substance abuse disorder. Standardized issues include having a child in out-of-home care, for instance, children and families experiencing foster care. Multifamily group therapy also works with families where there is violence and law-breaking, chronic physical disorder, and also it is used in schools, for instance, involving a problem such as bullying. Groups. Due to the name, it is obvious that this type of therapy is performed in groups. Groups do differ in terms of who from the family is included and in how many families are included in the group. Family groups can be labeled family members, and be invited to the group, which can involve anyone else who is concerned or where they appear to play a major role in the family's functions, and are involved and willing to make the commitment to attend. In other words, this can include grandparents, aunts, cousins, daughter, boyfriend, foster parents, and so on. What to avoid? It is recommended to not include both divorced parents and their new spouses or love interests. Do not include anyone who would be disruptive to the group or dangerous to others. do not include anyone who is not ready to openly deal with a problem, where that problem is the focal point in the group. When it comes to ages, multifamily group therapy accepts all, although the ages of participants can cause problems. With different researches, it has been shown that babies and children can possibly cause distraction, but it mainly depends on the size of the group. When the group is large, or the amount of infants and children is large, it can cause enough distractions where the group has issues to productively function. It has been found through other settings that the minimum age of 8 helps create minimal problems. And how do you recruit families? The earlier in care the family is recruited, the better the likelihood of their agreement to participation in multifamily group therapy. And most agencies that offer MFGT consider it to be an essential element to their overall care of treatment. The involvement is important in order to maximize the chances of successful treatment of care for each individual. It is also important to have everyone's input in order to get a clear idea of the problems. Settings. Therapeutic settings should be established and consistently held. Therapeutic settings is confidentially maintained, safe, and respectful. Client characteristics involve the client is not psychotic during the session. The client is willing to consider need for change. The client is able to speak and understand the language being used. The client is in regular attendance. The client is in a sufficient health to participate and function. And a child client is given protection from further abuse and neglect if abuse and or neglect has occurred in the family. Therapist characteristics and qualities are involved with most any other therapist. The therapist is non-judgmental, is empathetic, understandable, a good listener, and has flexibility, has the ability to be directive when necessary, is able to attend a group process, is able to establish a safe environment, and has the ability to effectively collaborate as a team member with co-therapists to support the group as a whole and to encourage every person to be a part of the group. Group size usually consists of a wide variety for the size and the composition. In one article, their group size varied from 3 parent-child families to a large group of 30 to 40 people included, whole extended families. This group structure also varied from free-flowing discussions to rotating interviews. In Edwards' article, the group norm seems to be 4 to 7 families per group, but has done a group with as many as 13 families. But the smaller range seemed to be more workable. This creates a group large enough for the families to have the opportunity for group attention and involvement. Frequency and length of group was different in each article, but the norm seemed to be weekly meetings, possibly half an hour to 2 hours in length, although there are groups that meet once a week and spend a full day together, and programs that meet all day for a whole week, or even possibly up to only once a month. Settings involves a group large enough for the amount of individuals to move around, but to possibly create a circular setting arrangement for the families to sit together. Couches, love seats, chairs, etc. was recommended from the articles. Open versus closed group. The focus is to be open-minded groups involving families at various states of treatment in each group. It is important for current families a part of the group to be welcoming to new families when joined and allow new families to see and hear about the other families at various stages of recovery, and to see them celebrate the success of families who are preparing to leave the group. This can help provide support and increase the positive changes and helpfulness in other families who are still new or still in the process of recovery. This approach shows how families are welcome to join a group whenever wanted and has no need to wait for a new group to be recreated. Last but not least, I will mention staffing. Co-therapist as opposed to single therapist is preferred, although this is mostly costly for the agency. As with any co-therapy, it is necessary for the therapist to agree upon how they will work together. In other words, one therapist would be responsible for leading the group, with the other therapist being the observer and the supportive role available as requested by the lead therapist. And from group to group, this role would be traded off.
Okay, everyone, you've heard the history and some specifics on multifamily group therapy and how it's good for families going through chronic, stressful situation. I'm going to get into some of the research, and I'm going to try to be as thorough and as quick as I possibly can. I've highlighted some of the more routine uses for the therapy and also some of the newer applications. Okay guys, for the first article we're going to look at 3 treatment conditions and compare them and their ability to prevent the recurrence of bipolar 1 mood episodes and subsequent hospitalizations. The 3 conditions are individual family therapy plus medications, multifamily group therapy plus medications, and medications alone. And for this, I'm just going to focus on just the multifamily group therapy. It was defined as having 2 therapists, a clinical psychologist which led the group, a social worker who assisted 4 to 6 patients and their families. 6 90-minute sessions were completed with content of each session predetermined. The curricula focused on things like signs and symptoms, experiences and concerns, coping strategies, medications, personal responsibility, perspectives, experiences, and reactions, and then finally the last meeting where they discussed the main themes. So what they found was that only 5% of the participants who received multifamily therapy and medications required hospitalizations. This is comparison to the 31% who received individual family therapy and medication and 38% who just received the medication alone. So multifamily group therapy may significantly assist in the prevention of hospitalization for a mood episode, but the therapy did not show any superiority to medication alone, and it may be that multifamily group therapy helped families with their basic knowledge of disorders, gave them some adapting coping mechanisms, decreased their burdens, and normalizes their experiences, which reduced the fear and isolation commonly felt in those situations. And then with all of that additional knowledge, they just did not seek out hospitalization as much as the other groups did. All right, this is multiple family group therapy for eating disorders. This one is interesting if you want to learn a little bit about the variations of multiple family group therapy. There is PMFTG and UMFTG described in this article. What they found was that the research suggests that the psychoeducational multifamily therapy group was more effective than medication alone in treating eating disorders, and it decreased morbidity and relapse rates over psychoeducational single-family therapies. The really amazing part of this is the beneficial time frame for the therapy is up to 4 years or more. And it was significantly effective in decreasing caregiver distress. Keep in mind, as always, the references are in the notes section, and I encourage you to definitely check this one out if you're interested in the different variations of the therapy. Okay, so this article is about the MFGT for veterans with PTSD. It's an examination of an adaptive multifamily group therapy focused on veterans that have a diagnosis of PTSD and their families, and it is called the REACH program. I'm going to go through it really quickly. It has all of the main components of multifamily group therapy, and its focus is that the human connections that emerge over the participation of the program are extremely powerful. Results suggest significant changes over time for the veteran regarding the knowledge, the understanding, and the coping ability in regards to the diagnosis of PTSD. And of course, there's also empowerment, problem-solving skills, and communications that come along with that. Interestingly enough, it did not increase the relation satisfaction for the veteran, but family members said that it did improve their relationship satisfaction. So that was kind of an interesting little side note for that one. So just keep in mind that REACH and multifamily group therapy is something that we currently use for our military veterans, and research has suggested that it is quite efficient. Okay, this one is MFGT for substance use disorders. It is a qualitative account about the experiences and the themes discovered during the therapy. Of course, there was broken family relationships, breaking through the fear of being intimate with another person, shared understanding, better communication, increased self-awareness, and of course, the fact that recovery is an ongoing, lifelong process. So what they found was that therapy provided critical support and allowed individuals to address some of the family patterns that were maladaptive and assistive in breaking through their denial. Like many other instances of MFGT, it normalized their feelings and their experiences, and people were able to become vulnerable to the process and learn new coping skills and really build up and strengthen their interpersonal communication skills. So finally, I will discuss MFGT for acquired brain injuries. There were some problems naturally with this research because of the brain injuries and the consequences that different injuries can have on the brain itself. So this followed the McFarland's family psychoeducation therapy. It aimed to provide resources, strategies, social networking, and it specifically stated that it followed the therapy to fidelity, with 6 to 8 families participating for 2 educational meetings and 8 problem-solving sessions. So numerous themes were identified. Those are the connectedness, of course, identity, and the increased self-awareness, and an improvement in knowledge and understanding. The conclusion of the research was that the therapy experience successfully contributed to the journey of the participants discovering a new sense of self after their injuries, increasing their communication, and just simply finding their place and adjusting to this new normal that they will have to live with for the rest of their lives. This one is extremely interesting, and they do go into some depth about the complications of the injuries themselves and how difficult it can be providing multiple family group therapy. So in conclusion, I know I was really fast and not as thorough as I would like to have been. I encourage everyone to check out these articles. The therapy itself has extensive research behind it and is applicable to many populations of clients. And as always, have a great day. Thanks.